should be all review from A and P, but if you were to go ahead and draw blood, that blood is made up of two major components, the plasma, which is the more liquid component, and the cells, and we can, using a centrifuge, spin and separate the two of them, and we find that the plasma is that watery, straw-colored fluid, and the cells that are there are suspended within. There's three primary cell types that are within the blood: the erythrocytes, leukocytes, and the thrombocytes, that are known as white cells, red cells, and platelets. And this is kind of, if you look under an electron micrograph, what they would look like. And we see that the erythrocyte is this concave disc, the leukocytes are the little fuzz balls, and the platelets are kind of hard to pick up on, but they're like little things that are there. That's a medical term, things, right? Yeah. They're all formed from a common origin, a stem cell in the marrow. Depending upon what is low in the bloodstream, certain hormones are released, which trigger that marrow to produce one or the other. For instance, there's one called erythropoietin that, if it senses the fact that their red cells are low, causes that hemocytoblast that's starting off to end up going down this leftward channel as opposed to going to one of the other options that are there. But they all come from a common starting point. The erythrocytes are the most common cell that we end up having. There's somewhere between 4 million and 6 million erythrocytes per cubic millimeter. And there's obviously some variation based on gender. In the percent, if you were to look at the percent of erythrocytes compared to the total blood volume, we call that hematocrit. And the hematocrit is normally somewhere between 35 and 50, again, gender specific in the process. If we were to spin it down, this is what it would kind of look like. Roughly, your hematocrit's about 3 times what your hemoglobin level is, as we'll find. These erythrocytes are very small in diameter and thickness. I think I made mention previously that they're about the diameter sufficient enough to pass through the pulmonary capillary in single file, so it's pretty nice. Produced in the bone marrow, destroyed by the liver and spleen. We know it's about 120 days, which is why you can't get blood more often than that. And the most important component of that erythrocyte is the substance called hemoglobin. And the hemoglobin, we'll find, is not only useful for oxygen transport, it also facilitates the transport of carbon dioxide. We call a reduced level of erythrocytes or of the hemoglobin itself, because they kind of go hand in hand for the most part, anemia. And we call elevated levels polycythemia. And we'll end up finding out that patients with chronic lung disease, patients with chronic hypoxemia, develop polycythemia as a compensatory mechanism. That hemoglobin, again, is made up of protein. Normal level is somewhere between 12 and 17. The hemoglobin itself carries oxygen, and this number here is a value that you'll want to, we'll see become very important in a second. But it's 1.34 milliliters of oxygen is carried for every gram of hemoglobin that is present. These heme groups, the protein component, no. That's not right. The globulin groups are in red and blue. The heme groups are the iron portion, which is in green. Okay. But there's a combination of 2 different strands of proteins and a iron molecule that is there that is bound to. Here's a better look at it. There's an alpha chain a beta chain, and then they got them here as little discs of iron +2. Okay. And we'll talk more about that when we talk about oxygen's carrying capacity. I think it's module G, maybe, something like that. The leukocytes are less numerous. They do have a nuclei. If you remember, the erythrocytes do not. They're a concave disc that does not have a nuclei. The white cells, on the other hand, do. And the primary function of the leukocytes, obviously, is as a protective mechanism against invasion by bacteria or other foreign agents. Two types that they're broken into that you should know: the granulocytes and the agranulocytes. The granulocytes have different shape to their nucleus, where the agranulocytes are basically just clear cytoplasm. There's no granules that are there, i.e. why it's agranulocytes. And normal value is somewhere between 4,600 and 10,000. Excess amount of white cells we're going to call leukocytosis, and this is usually occurs secondary to a response to infection, although blood diseases like leukemias can end up having great alterations, really either way, but certainly on an increased level. Leukopenia is what we use for the term of reduction in white cell counts. And the unique part about the white cells is they have the ability to move in and out of the vascular system, which is kind of cool when you think about it for a half a second. It actually can, as a response to an inflammatory event or something where there's an infectious agent outside of the bloodstream, it'll actually move out of the vascular space into the interstitial space and into other cells to be able to combat the infection that is there. And that's called diapedesis, which is kind of cool. It releases all these things that are internal to the white cell that are disease fighting. You can see our little bug here. It actually looks like a bug. But the white cell basically engulfs it and destroys it. Along with, there's multiple types of leukocytes present, and we call the breakdown of each type of those as a differential count. And when you look at a complete blood count, it not only has obviously the red cells count and some information about the erythrocytes, but it also has the breakdown of what percentage of white cells are present. Now I'm going to go through this and I will tell you specifically what I want you to remember, because a lot of this is not stuff we necessarily need to have a whole lot of information on, but this just shows the different purposes for the neutrophils, eosinophil, basophil, lymphocyte, monocyte, macrophage. Let me talk about the ones that are what I want you to know specifically. The most numerous one of all the erythrocytes, of all the leukocytes, is the neutrophil. Usually somewhere on the order of 60 to 70%. You can definitely distinguish them if you look at it on a microscope. They're much larger than the red cells. They're granular in nature. And they produce substances that basically fight infection. It's the primary function. When we see an increase in level of neutrophils, one of the features of that is that sometimes some of those neutrophils are what we call banded or non-segmented neutrophils, and these are the neutrophils that are not fully developed yet. The analogy I use, it's probably a bad one, but I'll use it anyways. You guys are stuck with me, so there's no way around that. In the case of a war, a battle, at some point all of the of-age men are already engaged or dead or whatever, wounded. And so the king makes the decision to send the 12-year-old boy into battle. even though he's not fully prepared. That's what these banded neutrophils are. They're basically the body saying, oh my God, this infection is so huge, I'm going to release. Even if you're not fully developed yet, go out there and fight. It's something, okay? It's a sign of basically an acute infection. We call this a shift to the left because they're basically moving back in time or sending out immature cells, okay? So if we say that we have an increase in neutrophils with a shift to the left, that means that it's an acute infection. And it's kind of a large one that's overwhelming. And it can get to the point, especially in patients that are immunocompromised, where their white cells can be reduced, or low number of neutrophils, specifically neutropenia, and that can lead to infections by opportunistic organisms. That term, have you heard of that term before, opportunistic? Did they ever talk about that? Basically, they're infectious agents that ordinarily would not compromise us. Okay, but for whatever reason, our immune system is impaired now that infection takes over. Okay. The enterovirus that is G80, whatever it is, the one that's basically causing all kind of havoc in kids and asthmatics, is an opportunistic organism. Ordinarily, we're able to fight it off, or it doesn't impact us. But because there's a different strain, maybe for whatever reason, it's something that kids are having a hard time with.
I just want to make sure I have it right. The increased neutrophils and a shift to the left can cause an infection.
Is a sign of infection.
It's a sign of infection.
Right.
Is it increased in neutrophils in general, or is it only
both? Both.
Both. Okay.
Yeah. You'll end up seeing the white cell levels rise, and you'll also see that part of that increase is the fact that we're seeing these immature cells being spilled into the system. Good question. Eosinophils are one of the leukocytes that we're going to pay close attention to because it's related to allergic reactions. And what we'll see is in asthmatics, certain asthmatics, they end up having an increase in eosinophils. Normally it's a very small portion of the total, but it gets spiked in that point in time. Basophils, again, are ones that come to sites of infection, and they release not only defenses to go ahead and try and kill whatever is there, they also release some other things called chemical mediators, and these are the things that cause the swelling and the localized inflammation, things like histamine, serotonin, prostaglandins, that kind of stuff. Monocytes are more associated with chronic infections, things like mononucleosis and tuberculosis. And then finally, lymphocytes are related to the antibody-antigen relationship. And we divide them into B and T cells, and I'm not going to go beyond that. You're not going to be histology people, so who cares? But they basically are related to, again, an inflammatory process. And that's about all I want you to know. Other than the fact that the neutrophils are the most abundant, I don't care, you know, the percentages of the others. Monique? No. Other than the fact that the neutrophils are the most. Finally, there's the thrombocytes, which are the smallest. Go back to that picture. They're just kind of small cells. Normal count, and I do want you to know normal value for the erythrocytes, the leukocytes, and the thrombocytes. We didn't make that point clear. But they're far less abundant than the other two. somewhere in the order of 150 to 400 per cubic millimeter. And these are the ones that are responsible for the blood coagulation. They're part of that whole clotting cascade of events that ends up happening. They contain a substance called serotonin, which, as we saw previously with the basophils, because they release serotonin also, but they're responsible for constriction of the small vessels, which allow for that clotting to begin the process of. And we call a reduced level of thrombocytes thrombocytopenia. Increased. I'm sorry, for thrombocytopenia, is decreased. If I didn't say that, I meant to say that. So those cells are then suspended in the plasma, the straw-colored liquid, but that plasma also contains all the other stuff that we have, all those ions that are circulating around, calcium and sodium and chloride and bicarbonate. For that matter, all of our gases, our oxygen, the PaO2 is the oxygen that's dissolved in the plasma. Glucose, amino acids, cholesterol, hormones, along with all the waste products of metabolism like urea and creatinine and other substances. Most of the plasma, if you look at it, is water. Some protein, some trace other elements. But it's basically just the carrying substrate that transports the cells. If I take the clotting factors out of plasma, it's called serum. Why that's important, I'm not entirely sure, but just so you know the term. I think we've seen these guys previously. And if you have not committed them to memory yet, that's where we should be. In every hospital you go to will have slight variations on these, but for our purposes, we've all come to the agreement that these are the numbers we're going to use. Okay. Pardon me?
Do we need to memorize the numbers?
Oh, yeah. Sorry.
Are the numbers just the normal values?
Yeah, it's normal values. But if you haven't got to the point yet where you'll want to memorize them, or you have memorized them, you'll want to start committing them to memory. I will tell you, for my purposes, if I'm going to give you a value that's out of range, it's going to be out of range. It's not going to be something where I'm going to give you a sodium of 146, and you're going, oh God, where was the top end of that? It'll be 150 or 160 or something like that, where it's obviously out of range. Okay, so let's go back to our example we used in the beginning. Patient presents complaining of malaise. What's malaise? Yeah, that feeling that you just don't want to do anything. You're just bleh. That awful feeling you have when you have the flu. You know what I'm talking about now? That's malaise. Cough, fever for 3 days. This doesn't sound good. Vital signs show a pulse of 115, a blood pressure of 138/86, and a respiratory rate of 26 with a temp of 39. Pretty much everything's increased there. Blood pressure is not terribly out of range, but obviously there's something the body's responding to. Auscultation, listening with a stethoscope, reveals diffuse rhonchi and crackles throughout all lung fields. Now, what the heck is rhonchi and crackles? They're sounds that aren't normally there. If you were to listen to somebody normally, all you would hear is this nice, smooth airflow moving in and out of the lungs. These are what we call adventitious sounds, something where it's not normal. A CBC, complete blood count, is ordered and shows a hemoglobin of 14. It's normal. White count of 15,000. What's normal? 4,600 to 10,000 per cubic millimeter. So it's definitely elevated, yeah. With a neutrophil count of 80%, that's high, and a shift to the left. implies that we have the banded. It's a sign of infection. So what disease might be suspected? More than bronchitis even. How about pneumonia? Especially if we're identifying these adventitious sounds from a particular portion of the lung. We could say we had a right lower lobe pneumonia. I think I'll stop there.